Welcome to our video on what to expect in treatment. At the end of the video, please complete the post-learning check-in found on the Family Learning Series webpage. This brief check-in will provide feedback to DDAP on the usefulness of this video and offers the opportunity for suggestions on future learning to possibly be developed. Individuals seeking treatment or support for themselves or a loved one can call the toll-free PA Get Help Now helpline at 1-800-662-4357. It's available 24 hours a day, 365 days a year, and staffed by trained professionals. A live chat option is also available online or via text message at 717-216-0905. For those seeking help who may not be comfortable speaking to a helpline operator, remember, you are not alone in this. Some things you can expect from this course are the assessment process, program referrals, preventing return to use, funding options, staff you may encounter, and how to be supportive during the treatment process. Let's get started. The decision to participate in treatment is often difficult to make for an individual with a substance use disorder. You as a family member may believe that help is needed, but that doesn't mean your loved one sees it that way. This is one of the hardest things about dealing with the problem, denial and not wanting to get treatment. Try to stay calm and positive, and keep encouraging your loved one as they become ready to make changes in their substance use. And, most importantly, get support for yourself and other family members. If your loved one does choose to start treatment, it can be a hopeful but confusing time. Hopefully, this information will help you navigate the treatment process. One important resource is your county's Drug and Alcohol Office. In Pennsylvania, local treatment programs are administered through county offices called single county authorities. These agencies can help with assessing the need for treatment or other services, funding, and referrals to match your loved one's needs. Each person's experience and needs are unique. Next, we will discuss the process leading up to treatment. The process usually begins with an assessment to determine what type of treatment would be a good fit for your loved one. The most effective treatments meet as many of the individual's needs as possible. The assessment includes things like your loved one's past and current experiences with substance use and withdrawal, their physical and mental health needs, including trauma and its impact on their life and the risks they face for returning to use. Their living situation and how much support they have are also examined in the assessment. The type of treatment they receive is determined by the services they need. This is referred to as the facility's level of care. Once the assessment is completed, your loved one will be referred to an appropriate program. Some facilities are equipped to handle withdrawal management and provide intensive medical services for those who need it. Other facilities offer residential treatment with varying levels of intensive support for individuals to begin their recovery. Others are intensive outpatient facilities where individuals reside away from the treatment center, but return daily or several times a week for treatment. Finally, there are less intensive outpatient therapy programs that focus on preventing return to use and developing coping strategies for continued recovery. The level of care of the facility has a lot to do with how much time your loved one will spend in counseling sessions and what other options are available to them. Your loved one will likely discuss payment for treatment with someone familiar with the services needed. This may be a local drug and alcohol office, an employee of a private insurance company, or a representative of the treatment facility. There is a lot of help available for treatment, and you may be surprised to find out how accessible it is. Assessment and funding discussions must be done with the person receiving services. While family members may be able to get general information on what is available and what is needed to move forward in getting treatment, your loved one must be willing to answer the questions and do the paperwork involved in setting up treatment. You can help by encouraging your loved one to be patient with the process and be honest in talking about their history and needs. Remind them of the reasons they are seeking help, whether that is because of legal trouble, family concerns, or health problems, and let them know you support this decision to seek treatment. Now we will discuss the types of workers your loved one may encounter and important things to know about treatment. There are several kinds of workers your loved one might encounter as they begin and participate in treatment. A clinician with education and experience in substance use treatment may be called a counselor or therapist. This person meets regularly with your loved one in group and individual sessions. Most clinicians have a background in social work or mental health, as well as in substance use treatment. Clinicians often work closely with certified recovery specialists, or CRS, who have lived experience in recovery as well as training on how to use their own experiences to help others. Depending on the facility, there may be paraprofessionals called aides, techs, or monitors that assist with the day-to-day logistics of the program. A case manager will help your loved one make plans for future treatment, where they will live and what they will need when they leave their current facility, and help them access a wide range of services for continued recovery. Some programs have staff assigned to contact families and answer questions you may have. Many treatment modalities include medications to help with withdrawal, cravings, and maintenance of recovery. You will probably have lots of questions on what these medications are and how they are used, so don't be afraid to ask. Of course, medical facilities will have physicians and nurses to make sure your loved one gets the care they need. And many facilities have chaplains to help with spiritual concerns, as well as staff to provide recreational and educational services. Sometimes, family members have gotten so used to jumping in to help their loved ones that they may feel left out once professionals get involved. This is a good time to focus on yourself and the many things you have probably neglected over the past months or years. Step back a little and let the treatment staff do the heavy lifting for a while. Here are some important things to know about substance use treatment. You probably won't have much contact with your loved one while they are in residential care, especially at first. This can feel strange. Remember that individuals need to focus on getting acclimated to the facility and beginning their recovery. Phone calls with family can disrupt this process. All the staff of the program are required by law to maintain strict confidentiality about individuals in treatment. You will not be able to get any information if your loved one has not signed a written consent for you to be informed. Even if they did, the information is limited. The staff are not trying to keep you out of the loop, but they must follow these regulations very closely. If your loved one consents to your involvement, communicate with the clinician anything that may help them to help your loved one, and ask for their suggestions on how you can support them. Each facility has its own rules about things like visits, phone calls, mail, and packages. Be respectful to staff and follow these policies. It is common for people to want to leave treatment before they have completed the program. The early days are hard. They may be experiencing the effects of withdrawal, and they are afraid and just don't feel well. They usually turn to family members or friends for a ride home or for money to leave. If you get a request like this, stop and think before you do anything to take your loved one out of treatment. Remind yourself, and them, of why they entered treatment, and tell them you support their decision to remain in treatment. Then discuss the conversation with your loved one's counselor and reach out for support for yourself. If you wait it out, your loved one is likely to stay where they are and continue treatment. Finally, if you are asked to participate in a family program or counseling session, do your best to attend. This is a great way for you to show your loved one that you support their recovery, as well as get information that will help you move forward. Use this time to learn more about substance use disorders and recovery and set up support for yourself during this time. As your loved one continues in treatment, you will likely see an improvement in their attitude, physical appearance, and overall health. When they are ready to move to a new level of care, they will be referred to another program. It is important to remember that treatment is a long-term commitment. And just because your loved one has finished one level of care does not mean they are finished with treatment. It might help to think of it as you do a hospital stay. A person might be in intensive care, a unit that provides a high level of care for a short period of time. Then they go to another unit of the hospital for continued care, and perhaps a specialized facility for more treatment. Finally, they go home and have appointments with therapists and physicians as they recover. Assuming they can speak with you, The facility will give you the details of what the next steps are for your loved one. The first step in long-term recovery is treatment. You can celebrate these early days while you learn more about how to support your loved one as they continue treatment and begin the journey of recovery. Thank you for watching DDAP's What to Expect in Treatment video. Please complete our quick post-learning check-in so we know how beneficial this was for you, and to offer any suggestions you may have for other videos you would like to see. Don't forget, you are not alone.